Social distancing has now become an intrinsic part of our vocabulary. But how do you explain this novel concept to children? And what if your child is in a hospital and you cannot see him or her due to COVID-19 restrictions? Hospitals in Peru are now relying on video calls to keep the children connected to their parents. Our next report has more details. All of us are trying to come to terms with a post-pandemic world, while the deadly virus is still very much a part of our lives. We're all now inculcating new habits to live with it and even survive it. Be it social distancing across the reopened cafes in Spain, or students greeted by masked teachers at a reopened South Korean school. The new normal looks very different, and it may be the hardest on children. Children admitted to hospitals in Peru have to contend with a forced separation from their parents. As COVID-19 cases near the 100,000 mark in Peru, hospitals have imposed a rigid protocol. All visitors are banned, including parents of those children who are battling illnesses aside from COVID-19. Several specialized pediatric centers in Peru care for children and adolescents with complex diseases. And now they are faced with another challenge of guarding them against COVID-19. But the separation of children from their parents can have a damaging impact on their mental health. And so, one hospital in Peru has introduced video calls, especially for children from lower income families. 9-year-old Jeremy is just one of the few patients at Peru's National Institute of Children's Health who has spoken to his mother on a video call. While the virtual meeting may pale in comparison to a hug, Jeremy happily shows her his sketch of his favorite cartoon character. Other children can't help but yearn for more.
These video calls for us have been very gratifying because we have seen that children who one way or the other due to the situation have had to separate from their parents with restricted visits, well, it's a way to connect with them so that the detachment they have had is gradual. The nurses during their breaks have set some time aside to be able to interact between the parents and the children.
These calls have now been dubbed as cheer calls made by the nursing staff and now form an important step in the recovery of these young patients. Bureau Report, WION. World is One.